So, hello everyone, and welcome back again to the Mycetoma Research Club. In today's session, Dr. Hiam Ali will be joining us for talking about advancing mycetoma diagnosis and the use of AI in histopathology. Dr. Hiam is a mathematician, and she's a postdoctoral researcher at Orleans University, and also she's a research assistant at the Mycetoma Research Center, and she's also a lecturer at the Faculty of Mathematics, University of Khartoum. Dr. Hiam, the floor is yours.
Can I talk before Hiam, please?
Yes, Prof, for sure.
Yeah. Thank you very much, Samira, for this kind introduction. I would like to say Hiam, she's a special person. She's a shining star. She's from the School of Mathematical Sciences, and now this is a Faculty of Mathematical Science, University of Khartoum. And in spite of being away from the field, she contributed a lot to the Mycetoma Research Center. She used to go to the operating theater, to the lab, to the histopathology lab, to process her material for her PhD. She was active member of the Mycetoma Research Center during the last few years. After she went to Paris, to France, she is still connecting with the Mycetoma Research Center till now. She is doing a great job, and she is doing a lot of work to promote the science in the Mycetoma Research Center. Our work is unique because now we are communicating with different members of the science communities, either from the science, from the medicine, from the pharmacy, and from other, from the media, and from other science experts. Hiam really, she is a very hard worker. She did a lot of work, and all the steps during her PhD, that was done by herself. As I mentioned, she used to go to the operating theater, to the lab at histopathology, to the lab at the Mycetoma Center, collecting samples, processing them, looking into the microscope, and then she go to do her mathematical analysis for this data. So this is an example of a very much dedicated person to do the work in a proper way. Hiam, we are very proud to have you here. By the way, again, she is a winner of one of the UNESCO very prestigious award, and that was in, not sure when, Hiam, but again, that was again a very prestigious award dedicating, showing her dedication to the Mycetoma Center and to the science and to her mathematical school as well. Thank you very much, Hiam, and the floor is for you.
Thank you very much for this nice. It's really give me a lot of hope and a lot of trust and confidence that I'm doing good and I'm contributing to the research and the science community. Thank you very much, Prof. And I hope I will be always under the expectation. Thank you very much. Thank you, Samira, for the introduction. And as Prof said, I am a mathematician, and I had the pleasure and the joy also to work on developing histopathology diagnostic model for mycetoma. And we used AI and image processing techniques for this work. So I will start with introduction and brief discussion in histopathology and AI, and then I will introduce our first semi-automated model for mycetoma diagnosis, which is called Mycetoma, and then I will also talk about Mycetoma Micro Challenge, which is a challenge on medical images organized by the Mycetoma Research Center recently last month to develop a fully automated model for mycetoma diagnosis, and I will conclude. So to start with, so what is AI? It is a field of mathematical sciences that allow or enable the computers to perform tasks that require human intelligence. So the computers could be able to understand images, language, text, or whatever task by learning those models to perform the task. So basically, there are two types of any artificial models. They are either machine learning models or deep learning models. The machine learning models, it's some sort of model that require human intervention, because in this kind of AI model, the human need to define a set of features. So to define a set of features that the human think they are descriptive or they are important, informative for the certain task, and then provide this kind of features to the mathematical or AI model to do the prediction or perform certain task. On the other hand, deep learning model is a completely automatic model, and it used the idea of neural network, which mimic the neural network in human brain. Through a set of layers, the model would be able to extract features, and as it go deeper in the network, it will extract more abstract features and eventually predict the outcome or the prediction. So whether they are machine learning model or deep learning model, AI in general could be applied into different discipline, different area of research, and also could be applied to pathology and more particular to histopathology. And when we apply it to pathology, it could have a very important impact or aspect. And just to mention, when we apply AI to medical pathology, this could significantly improve the diagnostic accuracy, because the model would be trained and exposed to different scenario, different kind of data, so it will have a better prediction or outcome. And it could also provide some sort of second opinion for the pathologist for some challenging cases. And also it could speed up the process of the diagnostic by analyzing any images, lab results, medical record, or even patient record. So it could speed the process. So these are just few to mention, but of course it could have many more impact or importance when we apply AI to medical pathology. This could be more interested when we apply AI into into resource limited setting. It could provide some sort of expert analysis in areas where are few expert personnel, and it could also reduce the workload in understaffed area. And of course, it could improve the accuracy dramatically in this resource limited setting. And to apply any AI model into histopathology, this could be done through different tasks. We could focus on detection task, where the main mission or the main task would be to identify any abnormality in the tissue cells or any tissue components. And it could also be applied through a segmentation task, where the goal or the main mission is to precisely identify or craft certain tissue component. This segmentation task could be more interested if we are focusing on to, for example, cancer research, where we want to identify a certain type of cells. So we will be more interested to have a very precise segmentation for this kind of cells. And we could also do some sort of analysis on the histopathology images and predict certain outcome. For example, if we want to predict the presence of certain disease, certain condition on those images without having to go through a detection or a segmentation task. So to apply or to perform any kind of this task, we need to focus on the basic of histopathology and to address them carefully. And we know that the histopathology basic steps start with collecting the samples, whether they are through surgical biopsy or needle biopsy. we had to prepare the samples, and this starts from this fixation up to the staining process until we were able to get the microscopic images or the microscopic slides. And eventually the part where the pathologist tried to analyze those slides by reporting certain results. So we have to address this basic step very carefully before we apply any AI models, because with this basic steps, there are many challenges raised and need to be addressed carefully. For example, there is a big limitation when we work with the AI model concerning the data. The data has to be a very diverse and comprehensive to be able to train the model efficiently, because few data, that's mean the model with few data, that means the model will have, let's say, modest capability or modest performance. So we have to make sure that the data are diverse and comprehensive for any training purposes. And also, we had to carefully address the labeling of the data, because training this model will basically depend on those labeling. For example, if we are working now on mycetoma research, we have to be very careful about identifying which component of the tissue are the grains, what type of the grain, are they mycetoma or actinomycetoma. So we always need expert personnel to perform this labeling. So we make sure that the model will be built based on a solid ground. And in certain cases or in certain research, we could also focus or give attention to the inter-observer variability that could be result on the labeling of the data. And for us, mathematician, when we develop any AI model, we have to think at the beginning how this AI model is going to be adopted in the clinical setting. Are they going to be explainable AI? For example, the task will be highlighting certain component or certain area in the tissue component and say, okay, you pathologists have to give more attention to this area, or the mission for us will be, okay, no, we don't want to have some human involvement. It just have to be a completely machine task. So we provide the outcome or the final outcome for the pathologist and just give them the results without need to have any intervention or involvement from them. So having all this in mind, we started 3 years with the idea of developing a model for mycetoma histopathology diagnosis. And this work was part of my PhD. And so the idea of the project started at the Mycetoma Research Center, and it was completed in collaboration with 3 partners in France: University of Tours, University of Orléans, and Department of Mycology and Tropical Medicine in Botany Hospital in France. Each one of these partners was responsible for a different area. So we work on pathology, image processing, and artificial intelligence until we managed to present our semi-automated model. So to develop the model, we had to work through three different levels. At the beginning, we wanted to define a proper data to be used for training the model. And as I mentioned, the data has to be a very diverse and comprehensive to ensure better performance. And then we used machine learning model to classify between the mycetoma grain. And we also developed a automatic segmentation method for the mycetoma grain. So the initial database used for developing the model was coming from 180 patients seen at the Mycetoma Research Center or from the field survey in Sudan. Those patients were randomly selected over the patients who have been seen during the last 5 years. We wanted to ensure homogeneous selection, and we also wanted to make sure like this patient have been dealt with more advanced diagnostic methods. And we did not focus on age or sex or race or whatever. We just picked the patient randomly, and we aimed to balance between eomycetoma and actinomycetoma cases in our selection. And we did another refinement for this initial database. So we end up with a database of 142 patients. And in total, we managed to get 864 microscopic images from those 142 patients, and 471 of them were EU, and the rest were actinomycetoma. And we used all this data to train and validate our models. So here are examples of the images, the grain highlighted in green and red. And as mycetoma grain considered to be the main characteristic of mycetoma diagnosis, we wanted to highlight this grain as the region of interest for our analysis. So we had to perform a manual segmentation for all the grains for all the images. And the segmentation had to be very accurate and precise, and so that we are sure that we don't include any other component that are not relevant to mycetoma grain. And because the precision of the manual segmentation will have a great impact on any classification models. So here are a summary of the data used for training and validation of the model with the different species included in the database. So we provide these images to, we use these images to extract the features or the descriptive, the quantitative descriptive for mycetoma grain, and we use radiomic features to extract, to define the feature from the manually segmented grain. These radiomic features are classified into three broad categories. They are either focusing on the color intensity of the grains, or the geometrical property and the shape of the grain, or more advanced features of mycetoma grain. So we focus on the texture and spatial intensity of those grains. So we extracted 102 features from the mycetoma images, and we feed these images to a machine learning model called partial least square discrimination analysis, which is a type of machine learning model that use the idea of the partial least square regression analysis by introducing threshold analysis to perform the classification, because we are dealing with a binary classification problem. So it's either mycetoma and actinomycetoma. So we use the concept of Bayesian threshold to do this classification. And here are the results we get. The figure to the left is a projection of the sample on 3D space. And we can see that there are formation of two loose clusters of mycetoma and actinomycetoma samples with a very good separation between them. And the figure to the right, it's the binary separation between the two classes. And to evaluate the metrics, to evaluate the performance of the model, we use different matrices, and such as accuracy, sensitivity, specificity, and Matthew correlation coefficients. And the results we get were in line with the results obtained from the Mycetoma Research Center. And with this accuracy, we believe that our model has the potential to perform similar to the expert pathologist at the Mycetoma Research Center. So it could be adopted in a rural area or any area that has a few expert personnel at the mycetoma diagnosis. And as we extracted the radiomic features to describe the mycetoma grain, we wanted to understand how these features are important in understanding the mycetoma grain, and how they are strong. They have strong impact on the classification. So we analyze what is known as variable importance in the projection score to understand the importance of each features on describing the mycetoma grain. This score had a threshold value of 1, as you can see with the dot line in red. So any feature score higher than 1 is considered to be more important on describing mycetoma grains and classifying the mycetoma grain. And we can clearly see that shape features, which are presented by yellow bar, has a trivial role in describing the mycetoma grain, while the texture feature has a dominant role to describe and to classify the mycetoma grain. So we could recommend to the pathologist that if you really want to have a very solid and strong capability in classifying mycetoma grain, you should focus more on the texture feature of the grains rather than focusing on geometrical description of the grain. And we also managed to describe the eomycetoma grain and actinomycetoma grain by analyzing this feature, and we find that eomycetoma grain tend to have a complex pattern within the grain, while actinomycetoma have more simple or regular pattern. And this also come in line with describing the mycetoma grain. So with this, we were confident about our model, the semi-automated model, but we wanted to further analyze this model because the model is a semi-automated model. So that means the user will have to do a manual segmentation of the grain before the model will be able to classify those grain. So we wanted to assess the robustness of our model to any segmentation error. And we perform what is known as eroding and dilation of the ground truth grain. This means that we perform some shrinking, expansion and shrinking for the actual border of the mycetoma grain. This way, we managed to create a new 25 sets of grains by performing this erosion and dilation with different sizes. So with this newly set of mycetoma grain, we train new model. We use this data to train and validate a new model and make the prediction. And we can see that the x-axis represents the training and the y-axis represents the validation, the accuracy in training and validation. And we can see that this quarter has higher accuracy comparing to the rest of the quarter. That means that if you want to have more robust performance when you perform the manual segmentation, you should carefully do the manual segmentation inward rather than outward, so that the model would be more robust to any segmentation error. And having this in mind, we end up with developing a graphical user interface for a mycetoma model, where the user could just upload the tissue image and then they could highlight the mycetoma grain in the image, just hit the analyze button, and they will get the results predicting the mycetoma type and provide also a confidence interval for this prediction. And the user could also export the radiomic features that describe the highlighted grain to Excel file for further analysis. And then as our mycetoma model showed to have a robust performance against segmentation error, we wanted to move a step further and automate this semi-supervision model by introducing automatic segmentation or automatic detection for mycetoma grain. And we used a convolutional neural network model, which is a kind of deep learning model to automatically segment the mycetoma grain. And for this purpose, we modified a unit architecture, which is some sort of deep learning model used in medical image segmentation. We proposed a modified version of this architecture to segment the mycetoma grain. So this is the original unit architecture, and here are the modified architecture that we used for segmenting the mycetoma grain. And so this part is meant to extract features from mycetoma grain. And as we go deeper in this network, it's extract more abstract feature. And this part, it's mainly meant for combining the features before it predict the segmentation of the grain. And to evaluate the performance of the segmentation, we used dice coefficients, which measure the overlap between the ground truth and the prediction the ground truth segmentation and the predicted segmentation. This coefficient has interval of between 0 and 1, where 1 indicate a perfect segmentation, perfect match between the ground truth, the segmentation, and the prediction. And we also use sensitivity, specificity, and accuracy to evaluate the performance of the model. And we find that our model achieved a Dice coefficient of 0.784 and a very good accuracy of 93.8. And you can see in this image, this is the grain, and this is the ground truth, and this is the predicted part. And and as we perform this automatic segmentation to automate the process of the semi-supervised model, so we could end up with a fully supervised model, we came to integrate the Pro unit model, which is the segmentation, automatic segmentation, with the Mycetoma, which is the semi-automated model to predict the Mycetoma grain. And we created a new test data sets, and we find that when we use Mycetoma or the semi-supervised model alone, we have accuracy of 90.8 accuracy, and with the integrated model, this percentage decreased a lot. We find this come from different. We find this could be caused by different reasons. For example, the model could detect a false positive grain or segment false positive grain, and this could slightly affect the performance. So we wanted to improve this further and work more on it. And with this, I concluded my PhD project, and we continue improving these results. And while we're improving this result, we got an idea of why not engaging the scientific community and open a call for all the scientists or AI experts from worldwide to participate on this task. So we organized a Mycetoma Microimage Challenge, and it was part of a MICAI conference last month. And on this challenge, we opened a call for the scientists to contribute to this and model or propose a fully automated model for a Mycetoma histopathology diagnosis instead of the semi-supervised or the semi-automated model. So the main objective of the challenge was to propose a fully automated model for Mycetoma histopathology, and of course this would improve the accuracy and speed of the diagnostic of Mycetoma, and this would be and if we manage to get this to be done, this will be will follow will be aligned with the WHO roadmap of the WHO that we need to use artificial intelligence to improve the diagnostic of neglected tropical diseases. So the challenge has two tasks. The first task was detection of Mycetoma grain, and the second task was the classification. We separate this challenge to two tasks because we wanted to have like a sub model, because it would be good if the model can tell us, okay, this is the grain, even if the grain is very small or it can be missed by human eyes. So the model could detect this grain and then classify it. So the pathologist could have insight into the two tasks. They could see the detected grain, and then they could see the prediction, the classes predicted. So the challenge, at the beginning, we had participants from 31 institutes presented from 16 countries, and the majority of them were participated as individual, and also the majority of them has intermediate experience in medical images analysis, while few of them has advanced skills in medical image analysis. And we end up with having a finalist team from US, UK, Spain, and China. And only one team has advanced experience in medical image analysis, and none of them has beginner experience. And we ensure that all the participants follow the rule of the challenge, that their models has to be a fully automated model for the mycetoma diagnosis. And we wanted to give them more freedom to develop their models, so we allow them to use any public data sets to train their models beside using the mycetoma database. And they could also make use of any pre-trained model to improve the performance of their model. And to evaluate their results, we allow them to provide 3 submissions, and only the last submission will be considered, was considered for the evaluation. And of course, all the participants possess the intellectual properties for their developed model. And to evaluate the performance of the participants, to know how their models perform for mycetoma classification and detection, we used similar metrics that I used during my PhD. So we used specificity, sensitivity as accuracy, and that's coefficient for the detection. And we used specificity, sensitivity, accuracy, and Matthew correlation coefficients for the classification. And as each team or each participant could favor different metrics to another, we wanted to have a uniform metrics. So we get the idea of using a weighted sum. So we define a coefficient for each of these metrics to calculate the weighted sum, and eventually use this weighted sum for the evaluation. So here are the results we get from the 5 teams, considering all the metrics. And for the detection results, we treated all the metrics equally. So we assigned them 25%, and we end up with this weighted sum. And these results are very interesting, because it's mean that all the models will be able to detect very challenging kind of grains that could not be seen by the naked eyes, or it could be classified as false positive grain. And so this result were really interesting. And for the classification results, we use different weights. We use different weight or coefficients for the evaluation. We assign the highest weight for the Matthew correlation coefficient, because we are dealing with a binary classification problem that has unbalanced distribution, because the number of pheomycetoma and actinomycetoma samples are not equal in the database. So it's better to rely on the Matthew correlation coefficients, because it has more interpretation for performance comparing to accuracy, for example. So we assign the higher weight for the Matthew correlation coefficient, and we end up with this weighted sum. So the majority of the teams achieve a higher accuracy, higher than 90%. And also this is very good and very interesting. And the highest percentage was 96%, which is higher than the human results reported at the Mycetoma Research Center. So we are very confident of the performance of the model, of the proposed model. So the final ranking for those teams, so this are the results for the detection, classification, and the overall performance. And the top performer were Adrian, who had advanced experience in medical image analysis. So we believe this task were a bit challenging to be performed. And that's it. So to conclude our talk, we would say that, or we will argue that AI or artificial intelligence could have a very significant impact on advancing the mycetoma diagnosis in terms of detection and classification, and it could improve the accuracy of the diagnosis. And all the developed model could be deployed into application, whether website or a mobile app or desktop app, and integrated into clinical workflow. And this way we will have a fast and more reliable diagnosis. And as a future perspective, we could engage different collaborator worldwide to enlarge the data sets and include different species. And with this enlargement for the database, we could improve the proposed model and we might have a better performance. So that's it. And thank you for your time, and thank you for being here, and thank you for our sponsors, the Sudanese Ministry of Higher Education, Campus France, and L'Oreal Foundation for Women in Science. Thank you.
Thank you so much, Hiam, for this nice and kind presentation, and also for enlightening us about how to design an AI model. From a personal perspective, I've never encountered how these models are designed. So now I think I had some information how these models are designed. So now the floor will be open for discussion and questions.
Yes.
Yes, Prof, you can clearly hear you.
Yeah, thank you very much, Hiam, for this nice, elegant, informative, educational talk about the use of artificial intelligence in the diagnosis of mycetoma using histopathological studies. I think this is one of the breakthrough in the diagnostic tools for the mycetoma now and in the future. And this technique can be used for other diagnostic tools, X-rays, ultrasounds, MRI, CT scan. Again, we can apply the same technique or techniques for the diagnosis of this. Now, artificial intelligence taking place. We are having cognitive computing, and computer vision, machine learning, and neural networks, deep learning, and natural language processing. All these tools part of the artificial intelligence and can be used to benefit the mycetoma management in the future. And having people like Hiam and colleagues definitely will come with a very good diagnostic tool to help in treatment of these patients. We are very much optimistic for the future. I'm sure that the future will be much better for the mycetoma patients management and other diseases, not only the mycetoma. But with all these artificial tools, definitely will come with simple, uncomplicated, straightforward diagnostic tools for these diseases, mycetoma and other diseases. Thank you very much for this enlightening presentation.
Thank you.
I think we're having now Professor Linia, our consultant histopathologist, to listen to her comments. Professor Jorge from Comboni College, and again to listen to his insight about this presentation. Thank you.
Okay, Assalamu alaikum. Thank you very much, Professor Fahal. Thank you, Dr. Hiam. I really enjoyed your talk. And actually, it is expected, of course, from what is happening, that AI in clinical histopathological service is expected to extend in the near future. But of course, there are many challenges. Because we're not talking only about mycetoma, there are other diseases like cancer and so on. So it is very useful for prognosis, like you mentioned, and for the treatment and so on. But actually, there are challenges. So when you design an algorithm, you have to be very careful. For example, if we're talking about tumors, and I know this is not the same context, but when we are diagnosing, for example, certain tumors, we look at the grade of the tumor, we look at the type of the tumor, okay? And we also incorporate immunohistochemical staining. So it's very challenging. When you're designing these algorithms, you have to take this into consideration. So all of these technologies, of course, it's like a breakthrough, and I'm sure that your team is going to develop an excellent algorithm or applicable for mycetoma diagnosis and so on. But these new technologies, we have to keep in mind that they will aim to complement human resources rather than replacing them, especially when I said that, I meant in the other fields of histopathology. But thank you very much. I really, really enjoyed your talk. It was really excellent. Thank you very much.
Thank you very much. Thank you.
You're welcome.
I also would like to congratulate you, Dr. Hyam, for this wonderful work. And as Prof. Ahmed said, it is a step forward in diagnosis, very, very, very big step forward. Of course, while you were going through your presentation, I was also dreaming, no? And then trying to see, up to which point artificial intelligence could be also applied for the treatment. I mean, as through your application, it is possible to diagnose mycetoma according to the shape, let us say, or the texture of the grades, etc., the images. Surely, when you apply different treatment, you can also have different images of how the histology, no? I mean, how the tissues evolve with the treatment. I don't know if I explain myself, and if there is also there a field, no? I mean, to apply this kind of models back to the treatment. Do you think that is also another field of research? Thanks a lot.
Thank you. Yeah, I think this could be a good idea. We could utilize this, and this we could utilize AI for like predicting the outcome of the treatment and the progress or the improvement. But this would be longitudinal studies, because we had to follow the patient through their treatment journey to collect the images or to collect the tissue from them, after each follow-up, to monitor the progress and to develop any model that could predict the improvement across the years. So it could be a good idea. Thank you.
Hyam, if you allow me, I see that Professor Dudu has a raised hand.
Hello, Professor Dudu.
Thank you very much. Do you hear me?
There is an echo. Can you speak up, please?
Do you hear me? It's
yes.
loud.
Yes, it's better now.
Okay, thank you very much, Samira, for giving me the floor, and thank you very much, Dr. Hyam, and congratulations.
Please unmute yourself. Professor Dudu, please unmute yourself. We can hear you.
Sorry. Do you hear me now?
Yes.
Okay, sorry for that. So thank you very much, and congratulations, Dr. Hyam, for this very nice presentation and work. And I congratulate as well Professor Fahal and all the team for helping to have these very, very nice results. And we are very glad of this work, because we are trying in our side to see how we can implement these kind of tools in the fields. and help for the diagnosis. I have 2 or 3 questions about this. So you said that you have 91% of good result from the IA compared to what you have in the lab. Did you try to see the profile of the 10 remaining person which did fail for diagnosis? Why did they not get these 10 remaining person? It was because there is the difference of staining or many other things from the patient. The second point, so I can let you just respond, or I can give you my three questions.
Okay, I think it would be better if I respond. So regarding the missing 10%, the misclassified samples were underrepresented in our samples. So we had very few species of those samples in our database. So I think the model were not able to learn or train on this specific species enough. So that's why it does not perform good on classifying this specific species. So that's why we said it would be good if we managed to enlarge the data sets and include different species and more species so we could improve the model.
Okay, I understand, Mom. So it will allow me to jump to the second point. It's about the validation process, because you have about the validation process, because you have used images to learn the machine to recognize the lesion compared to what you are doing in the lab. Yes. And I mean that most of the imaging come from the Mycetoma Research Center. Did you include many other images, or many of them are from the Mycetoma Research Center? Because I'm seeing how are going to be used in the validation. Yeah. If you plan to use it in the field, how are you going to do? If you are just going to share the algorithms with other center or other team in order to learn more the machine, or if you are going just to collect more images and learn for the machine to be learned.
Okay, so because this was the first study, so we were trying to let's say draw the map to know where to start. So we started from the samples at the MRC, and we included not only like samples from Sudanese population, we also had samples collected at Ethiopia, and they were sent to the Mycetoma Research Center for analysis. So I think this introduced a bit of diversity to the dataset. Mm-hmm. And this for the first part of the question. The second part, of course, the model is open, and will be really willing to share it with others so they could test it. So it could be some sort of prototype, so they could test the results and test the model and give us a feedback, so we could highlight the problems and like this way we'll be sure that this 10%, the missing 10%, are really coming from species problem, not from any other diversity or type of preparation or whatever. So we're really open for this collaboration and openness of sharing our codes and our model to be used.
Okay, thank you very much, and congratulations again, Dr. Hyam, for this very, very nice work, and good luck for the rest of the work.
Thank you. Thank you.
Yeah.
There are some.
Yeah. Yeah. Lemis.
There is someone raising hand. It's
Dr. Tika. Yes.
Hello. Thank you. Congratulations for your excellent talk, and I think the work is really excellent, and I want to congratulate you. But I have just a very simple question. Because others were already raised by my colleagues. And the question is if you think that this basic tool of applying AI to images can be also applied to the the images of the lesions, of the images of the X-ray or ultrasounds and so on, because in not all the settings in which mycetoma patients are attended have the option of using histopathology. So it would be wonderful if the image of the photograph of the lesions and the photograph of the X-ray or something or other tools could be applied in this way to get a better diagnosis. Thank you.
Thank you for your comments. So I think yes, I agree with you. It would be good because we're really thinking of using AI as a first line diagnosis. So we thought of developing an AI model for ultrasound images because it's field friendly and it could really help in early diagnosis of mycetoma. And we started this project, and it's in progress to building the model. We are in the process of collecting the data. And we can't really say this model could be directly applied because the different kind of images have different way of dealing with, because now we are dealing with RGB or red, green, blue images, and the ultrasound has a different nature and different type of images. So we had to define new models for this kind of images. But I agree with you, it would be good and interesting to consider other image modality or other diagnostic techniques.
Thank you, and congratulations.
Thank you.
So yes, Professor Fahad, go ahead.
Lamisa, I think Lamisa is there. It is in the meeting. Can you tell us a bit about the AI use for predicting new or inventing new drugs for mycetoma treatment?
Okay, thank you, Professor. And thank you, Hyam, for the wonderful presentation, as usual. And the use of AI in drug discovery is becoming more and more central, especially in the specific field of drug repurposing, because we have libraries of drugs that has sometimes millions and thousands of different compounds, and we even have libraries of natural products. And to screen all of these, all of these libraries in the lab, it would be very expensive and very tedious. So now more and more people are using AI, or researchers are using AI to sort of filter these libraries into compounds that are most probably going to be effective in treating the same disease. So they input for the AI model sort of the favorable properties that that is needed to be in the drug for it to be effective in treating that disease. And then the AI model, maybe Hyam could explain in that more if she has some idea, but then the AI model would be able to sort of scan the whole libraries and then pick the best compounds. And not just that, there are even now uses of AI for designing drugs, not just screening libraries, but designing new compounds, again, based on the information that, the scientists have for compounds that are currently working, maybe even information for some compounds that are currently, for example, if you're talking about antibacterials or, antibiotics or something, then, feeding the information of the resistance patterns of these organisms to the drugs would also be beneficial in maybe designing a drug that is very optimum and very effective. But yet again, my information is very limited on that, and I think maybe if Hyam has any other information, she could go ahead.
Thank you, Lamis. I think you have said it all. Yes, it's mainly work on these areas. It's either repurposing or trying to identify new compounds for certain disease, and it depends on the kind of the. I think the drug. You could use different techniques to predict whether it's going to be suitable for this or if you should follow this line. So I think you said it all, Louise. Thank you.
Thank you. Yeah.
So
There are someone, Rabbi.
Okay, this is Rabi' Mansour.
Hello, Rabbi.
Thank you very much, people of Mycetoma Research Center, for this opportunity. This is great, actually. We are very proud of you, Hiam, for this great job. And my question is a rather simple question. I am pathologist, so I don't want to say that you are endangering our profession, but
we always say we are not gonna, like, AI is not gonna replace you. It's gonna work in line with you.
Okay, but you see, we have to combine all things together, or the jigsaw puzzle. It is not only the geometrical or the pattern recognition, and it is rather clinical pictures. Have you any idea how you can incorporate some clinical data, as some of my colleagues said, like pictures or X-rays or any clinical data to enhance this information or your algorithm to detect the different types of mycetoma or the grains? And also for perspective of histopathology, the different stains. We have different stains to categorize the grains or the contour of the grain even. And also, you have said that you give your algorithm some information about the texture. Can you explain how you give this information? So I know that the picture generally would give the computer or these models the idea of the pattern, and how you come to give some information about the texture. And I want to say this is great, and it is opening new era in the diagnosis and helping us a lot to give more details and good diagnosis for mycetoma, and hopefully for the other histopathological challenges that we are facing. Thank you very much.
Thank you. So to start with your question of integrating or considering other clinical parameters. Yes, this could be great, and it's some sort of, let's say, a big model for AI, because it's a multi-model data or a multi-model AI, a multi-model AI. It's because we will be incorporating different kinds of data, so it will be structured and unstructured. For example, will include the patient record, the history, the clinical presentation, because it will be basically a measurement or descriptive for the grain, the progress of the treatment, or the initial presentation of the patients. Also, a skin lesion. So this is a multi-model, and for this we need to start by collecting a very strong and precise and homogeneous data. to have a successful input on this regard. So that's mean for each new patient from day one, we had to get all the parameters synchronized and organized. Yes, we have this data at the Mycetoma Research Center, but they were not big enough to train such kind of model. But we think and we believe if we incorporate this kind of clinical data, we could have a very stronger, more powerful models. So this is the first part, and the second part, excuse me, you ask about how we represent or explain the texture to the computers. So basically, the algorithm see the images as each pixel in the image is seen as elements in array or in a matrix. So to define a texture in the image, we do some sort of derivative, and we define the maximum and the minimum of the derivative of the elements at this matrix. And by defining this derivative, we can define the second order statistic. And those second order statistics define the texture. Different kind of texture analysis could be driven from the second order statistic that could be identified by applying the derivative to the images. This is how we could present the texture of the features, the texture feature of the images. Please
Yes,
remind me if I
yes.
missed any question.
Yeah, thank you very much. Just I ask also about if you can have some special stain. So sometimes we need to use, for example, PSA, for example, and special stain for determining different types of grain.
Yes.
Okay, can you consider to have some information to include them?
Okay. Yes, at the beginning, we consider all kind of staining. So even for the images we had, we perform special stains. But we realized that the majority of the image were like we were able to classify them using methoxylene and iocine. It's an stain. So we prefer to focus on this specific or essential stain at the beginning as the first step before we go further and include a special stain. So this would be a next step or the next stage of the project. And
thank you very much. It's a great job, really.
thank you very much.
Professor Fahal, I see that you have a raised hand.
Yeah, thank you very much. Rabia, thank you very much for bringing up all this new information and ideas. And that can be another area of study using different stains. As Hiam said, that H&E it is the most common stain used in the diagnosis of mycetoma, but definitely we need, in many cases, a special stain if there is great difficulty in identifying this organism by the H&E. So again, this is a very good area for a new study using different special stains to diagnose mycetoma. Definitely, these techniques will be complementary to the human being. Histopathologist will be there to look into these slides, to look into the computer result, and then he give us his final or her final decision about this. But in some areas where there is no histopathologist in many of the mycetoma endemic areas, people may rely on this technique, these computer applications. But again, histopathologist should be always there to confirm the diagnosis of mycetoma using this technique. This is the start. I am sure that that will help you a lot in your work. Now AI is used for publications, for writing articles, for many part of our new life. So that may help you in reduce the load on histopathologists by giving just a straightforward diagnosis, and histopathologist will go to concentrate on the more difficult slides and diagnosis. but definitely it is a complementary and not, it is,
Replacement.
yeah, absolutely. It's a complementary technique.
Yes.
And I'm sure with your presence, your assistant, we're going to refine the technique more and more in the future. I would like to say that we are involved with the WHO now in AI in diagnosis of mycetoma from simple clinical photos.
Skin images.
Yeah, simple images, clinical images. We loaded many of our photos to this website, and now they're doing the analysis. Hopefully, again in the future, from a simple photo of a patient lesion, we'll have a diagnosis of mycetoma. And well, you know that there is a lot of skin entities look very close to the mycetoma, and that may help in the future to have a proper diagnosis of these patients by simple techniques. Just imagine you are in the field and you have this application and you saw a patient and you took a photo, and then the system will go to analyze this photo and tell you this is a patient with cutaneous leishmaniasis or this is a patient with mycetoma. I think sky is the limit for our imagination in the future. With all these artificial intelligence technique, definitely we're going to help a lot our patients and our clinicians to reach a diagnosis and to have a proper management of these patients. Thank you very much.
Thank you, Professor Al-Fahal. This is great, and I would like to congratulate you. You are the leader in this field of mycetoma, and also bringing bright ideas and such brilliant people to our field. Thank you very much.
Thank you, Rabia. Thank you very much. I think the lesson from this presentation is the importance of collaboration and the importance of open science. Now Hiam, after finishing her PhD, she involved in this competition. She brought a lot of other young scientists, and they were together, and they converted the semi-automated into the full automated system for the diagnosis of mycetoma. So I think open science, I think Limis will be very much happy about this. And collaboration, things will going to improve the quality of things. And with the artificial intelligence, everything can be possible. Thank you.
May I add something, please? I know time is running short. I think regarding mycetoma, yes, the use of AI will help you, these tools, in identifying things that are difficult for human pathologists, let's say, like the microenvironment, for example, if you're talking about a tumor, but even the gray areas in mycetoma, things that actually pathologists and actually multidisciplinary team cannot really answer. For example, the melanin, things like that, for example, I can't really recall, but the use of AI, and I'm sure this is going to be in future projects, will answer or will help you a lot, even in combining the genetic profile of these patients and the histopathological lesions. I mean, things that cannot really be interpreted using humans. Thank you very much.
Thank you, Dr. Limis.
So, does anyone has a question or a comment? If you have a question, you can just raise your hand. Feel free to raise your hands. And here, actually, we're 14 minutes past our time.
Sorry for keeping you late and
No, it's really interesting.
Thank you.
And I see that people are enjoying the session and engaging in discussions.
There is a message in the chat.
Yes.
No, it's just a comment. Thank
It
you,
is
Mr. Najib.
So, Hiam, would you like to say something before we end up? Because I see there are no more questions and no more comments. And I can see I see no raised hands.
I think that's all for me. I already talked too much. So thank you for the invitation, and thank you all for the Mycetoma team and the Mycetoma Research for accepting me and learning me and teaching me actually. And I did all of this with their support and their help. And thank you, Samira, for organizing this talk. And thank you all for your time. And sorry for keeping you late.
Thank you so much, Hiam. It was really nice having you today, despite your busy schedule. And you took us through the world of AI and how can we utilize AI for diagnosis. And I think there are a lot of plans for future research for integrating AI in different clinical aspects of mycetoma. So I would like to thank you all for attending here today and bearing with us for another 15 minutes or more. Thank you all, and until we meet again next on our next club will be on 19th of November. Until we meet again, so stay safe and have a nice time. Goodbye.
Thank you.
Okay, bye-bye. Thank you.
Bye.
Bye-bye.
Bye.